Hello and welcome. My name is EshikaParuchuri, and I'm a junior at the Woodbridge Academy Magnet School in New Jersey. I would like to begin by thanking you for joining me in this initiative. My main objective is to educate and empower adolescents around the world to help them construct a healthier lifestyle by working with experienced healthcare professionals across different specializations. In addition to promoting health education, I hope to inspire many interested teens to pursue careers in healthcare, not just as future leaders, but as individuals who are prepared to respond to urgent public health challenges from everyday medical needs to global crises like the COVID-19 pandemic. Welcome to the Healthy Teens podcast. I hope you are keeping well. This month, I'm joined by Dr. Shefali Miglani, who specializes in optometry. She has extensive experience in this field, currently working as an optometrist and running the Monroe Eye Clinic in Monroe, New Jersey. And for this episode, we'll be focusing on understanding the eyes as well as the steps that can be taken to maintain proper eye care and a healthy lifestyle. And now, Dr. Miglani, can you give us a little background regarding your experience in this field?
Hi, Eshika. Thank you so much for having me on your wonderful podcast. Yes, I am an optometrist and I specialize in myopia management and dry eye management. I do have a primary care optometry practice here in Monroe, New Jersey called Monroe Eye Care. I've been practicing in Monroe for about 17 and a half years. Overall, I've been practicing for about 25 years. I graduated from SUNY College of Optometry in Manhattan in 2003. And ever since then, I've been in love with optometry and serving my community and my patients with all eye care needs. I also am a chief medical officer for Hoot, that's right behind me. That is a software company that I've built with my husband that specializes as a solution for doctors to use that solution for patient education in their clinic so that the patients can understand their issues and get treatment effectively.
Wonderful. So now let's dive right into our podcast.
Absolutely.
Starting with our basics and understanding vision. How does the eye work, and what does 20/20 vision even mean?
Yeah, eye is just like a camera. It has an outer structure, cornea, that is transparent, and it allows the light to go in to your eye, and it goes through the lens of the eye and then finally hits the screen in the back called the retina. And there are millions and millions of nerve fiber layer on the retina that's comprised of the retina. And that sends in information that the screen captures all the way through the optic nerve, all the way into the back of the brain, called the occipital cortex. And that's where you see. So you actually see from the back of the eye. It has, obviously, there's a whole specialty just dedicated to the small organ of the eye. But it is pretty complex, and there are many, many diseases, issues, refractive errors that happen that can be visually debilitating. So it is our job to safeguard people's vision and ocular health, and that's what we do. 20/20 vision means that a person sighted with perfect vision can see a letter at 20 feet. That's sort of like, you can imagine that's the limit of the eye that can see the small print. And so you would have 20/20 vision if you would stand at the 20 feet. So if you didn't have 20/20 vision and you had less than 20/20 vision, let's say you have 20/40 vision, that means that the normal person would be able to see that letter at 40 feet, but you would have to see it at 20 feet. Does that make sense?
Makes sense.
Yes.
And generally, how can someone tell if they have a vision issue? And can some eye conditions be asymptomatic?
Yeah. You can usually people know that they're blurry, especially if they're, they can't see the TV or they can't see driving, and that's called myopia or nearsightedness. And there is something called hyperopia, or farsightedness, where you are able to see far, but the close-up objects are hard for them. So it's a difference between minus and plus lenses. But usually people can tell if they can't see well, and different refractive errors can come up at different ages. But a lot of the times the doctors discover in the exam room that something is not right with the vision, especially if only one eye is affected and the other eye just kind of is dominant and sees well, so that eye takes over, and the person never realizes that they're deficient in the other eye. So regular eye exams are very, very important to determine if something is not right, because we do screen you from all the way from the front of the eye to the back of the eye, and all the refractive errors, and all screenings for glaucoma and anything that can go wrong in your eye.
Speaking of eye exams, at what age generally should a child have their first comprehensive eye exam done?
The American Optometric Association recommends an eye exam at 6 months or screening, and then 1 year, 3 years, and 5 years. Generally, people wait till 5 years to get a complete comprehensive eye exam, because at that point the child is more communicable and can cooperate in the exam room. But AOA does recommend an eye screening as early as 6 months.
And if a child does pass a school vision test, do they still require a full eye exam?
It's a very good question. So the schools usually just do a very rudimentary screening. I wouldn't even call it a screening. It's just having you read a chart that may or may not be at an appropriate distance. Usually nurses at school do a good job with screening, but you can miss a lot during the screenings. But that is not a comprehensive eye exam. Screenings just pick up very large refractive errors or problems with eyes, but there are so many things that are under the radar, especially with kids, that we need to evaluate, like an eye turn, like astigmatism. So just reading the chart cannot pick up everything. So an eye exam is definitely necessary. I tell everybody by the age of 5, they should get a comprehensive eye exam from a qualified doctor, from an optometrist.
And generally, at that age, what sort of signs or symptoms should parents be on the lookout as their child's eyes develop?
Yeah, so kids are really bad at telling their parents that they can't see. So a lot of the vision symptoms or vision problems are missed because they just think that's what their world is supposed to look like to them. So they don't really comprehend, quote unquote, the blur that we experience, we know. So the parents should be looking out for kids standing too close to the TV. They're bringing the phone or the device really close to their eyes, squinting, headaches, avoidance of reading, basically, squinting, something is not right. They can't focus on their work, etc. They can't pay attention in school. That the not paying attention can lead to other things, or there could be other issues, and just generally being a 5-year-old or 6-year-old. But parents usually have an inkling of like something is not right, and a lot of the times it's picked up by the school screenings, because the issue has become so big that they need to come in now to, but parents should look out for squinting, headaches, like just a face turn looking like this, or going really close to the TV or devices. Yeah.
And now that we're talking about sort of the common signs and symptoms, I was wondering if you could give us sort of an overview of what myopia is, given that it's so common around, kids our age?
Yeah, myopia is a huge problem. That's what my passion is, to be involved in controlling the progression of myopia. Myopia is also called nearsightedness, which means that the child is sighted for near. They can see clearly up close, but they have a hard time seeing far away. And that close point where they see clear keeps coming closer and closer because that's called progression of myopia. That's what generally happens. Once you're diagnosed with myopia, myopia usually gets worse unless you intervene with treatments that control myopia. So myopia is one of the refractive errors that is linked with other eye issues later on in life, because myopia is the stretching of the eyeball from the front to the back. The eyeball actually stretches extra stretch of the eyeball that causes stress that leads to other eye diseases later on in life. So you can have retinal detachments, glaucoma, macular degeneration, cataracts, early cataracts. That's correlated to your degree of myopia. So keeping myopia under a certain level, keeping that stretch limited, that eyeball stretch limited during your first and the second decade of life is very, very important, so that the child doesn't end up, as an adult with other eye issues that can be sight threatening. That is what myopia is.
And how does myopia differ from other conditions such as a lazy eye?
Okay, well, the one thing that I would like to compare it, not lazy eye, but that's not apples to apples.
Mm-hmm.
Myopia is different than hyperopia, or nearsightedness is different than farsightedness, because nearsightedness or myopia is corrected with a minus lens because the image falls inside of the eye, and hyperopia is that the image naturally without glasses falls outside of the eye, and you have to use different plus lenses to bring the image onto the retina. So it's just where the image falls inside or outside of the eye that determines if we use minus lenses or plus lenses to collapse that image onto the film, onto that screen in the back of the eye called the retina. And that's what is myopia or hyperopia. There's also other refractive errors called astigmatism. Astigmatism is the shape of your cornea. Instead of it being completely round, it is sort of oval. So instead of a round ball, a tennis ball, it's like an egg shape. So the light focuses on different parts. It's not collapsed. So you need cylindrical prescription to collapse that light image onto the retina. So it is a pinpoint. So you can see, the image is seen clearly without any stigmatic error. A lazy eye is usually referred to something called turning of the eye, or amblyopia, which means in laymen refer to lazy eye as an eye turn, but that's not correct. A lazy eye is amblyopic eye, which means that the eye does not have the ability to see 20/20, no matter even if you give that eye the exact amount of refractive error that it has. So it's the neuron pathways from the eye all the way to the brain are just not sophisticated enough to carry that signal of 20/20. So you have to strengthen that nerve pathway with amblyopic treatments or lazy eye treatments that strengthen and get that to 20/20. Usually the lazy eye is caused by an eye turn. So that's why the lazy eye is referred to, usually in layman term, they think that there's an eye turn. So one eye is just turned out or in, and it doesn't take fixation compared to the good eye. So it's kind of like turned. So when you're looking, this eye takes fixation at everything you're looking, but the other eye is always kind of turned. And so those neurons never develop. So we fix the eye turn, and then we block the good eye, make sure that the right eye gets more stimulus during the day, or especially during, fine writing or reading and writing. to strengthen that pathway. That's what lazy eye. Lazy eye is probably a little bit more complicated to explain than myopia, hyperopia, astigmatism. But I hope that makes sense.
Definitely does. We can see that there's a sort of a clear distinction, obviously, between myopia, hyperopia, and then there's another sort of category, if I'm understanding, for refractive errors in amblyopia.
Yes.
Okay.
Yes.
And generally, how important is it to know the family medical history when predicting any future vision or eye problems?
Yeah. In myopia, it's a very important question that I ask the parents because I'm interested in what got the child to be myopic. So is it family history? Is it nature versus nurture? Is it the environment more? So where do I have to focus more? Is it a lot of the times parents don't have any myopia and the kid ends up having myopia. And that's usually has to do with device use. These kids are born with an iPad in their hand and on parents' cell phone when they're busy. Parents are busy. So it's become a big problem. It's estimated that myopia will be half of the world's population by 2050 will be myopic. So, to answer your question, I'm sorry, what was your question? Because I got sidetracked with the whole myopia thing, because that's sort of my thing. What was your question?
It was just about how important it is to
Family history, yes. Yeah, so family history is important. So I would say under the refractive error category, myopia is probably the most important, where I would really drill down the family history. Family history is really, really important in other eye health issues such as glaucoma and macular degeneration, because that's something that is very highly correlated to you having glaucoma or macular degeneration if one of your parents has those issues. So we're really, really vigilant when one of the parents has those issues, to watch for other risk factors in the patient to make sure that they don't develop it, because both of those things sort of start out very silent and there are no symptoms to it until it's very late, and both those conditions are irreversible. So if they progress, we can't reverse it, we can only manage it, but there are ways to sort of prevent it from getting from stage 1 to 2 or 3. And family history plays a really, really important role. So family history is a very common question that we ask on every eye exam, every comprehensive regular eye exam.
Now we'll be transitioning into sort of talking more about adolescent vision health and daily habits. So along with myopia, are there any other really common conditions that you see in teens especially?
No, the most common refractive error is myopia for the teens. They can sometimes have hyperopia, which is farsightedness, or astigmatism, or both. Astigmatism can go with myopia or hyperopia. And sometimes they can have keratoconus, where this is a corneal issue that emerges in early teenage years. It impacts boys more than the girls, and that is sort of bulging of the cornea in one area, which causes the vision to deteriorate. So it's very hard for us to correct it with just normal lenses. We usually have to fit them with hard lenses to get good vision, and we have to really watch the progression of the cornea from getting worse. Usually it requires a corneal specialist involvement as well, and different topography scans to look at thousands of points on the cornea to see if there's any changes happening to the cornea. It is highly genetic, a genetic condition also. So, but a lot of the times when we diagnose kids with keratoconus, they don't know that if the parent had keratoconus or not. So yeah, so that would be, in terms of refractive errors, I think, myopia is the most common.
And when we're talking about teens, we also want to mention puberty and how it affects or it plays a role in the eye development. How does puberty play a role?
Um, I don't think I've read any studies on puberty and eye development, but I have seen anecdotally in my practice that when puberty hits and hormones are changing, that we do see changes in refractive error. We do see if a person is already myopic or especially myopic, usually there's an uptick in myopia. They destabilize. There's a huge influx in growth hormone. So the tissues of all of your body are very apt to changing to stimulus. And so if you have strain up close, you're using too many devices, you already have small amount of myopia, that can exacerbate a whole lot because you're going through puberty.
Mm-hmm. And how do things like digital devices affect the eye health?
The digital devices, I believe, I mean, there's a lot of strain that we weren't meant to be on devices like this. I mean, 10 years ago, there was no Zoom calls happening. We would talk face to face. There would be a camera, or people would just go out. Now we socialize on our devices. Kids are talking to their friends on devices. They're playing games on devices. They're not playing outdoors. So the world has changed dramatically. And it causes a lot of strain on the eyes because you have to focus up close. And we weren't meant to focus up close. We were hunter and gatherers. We were supposed to be farming outside, and we need really clear vision to make sure we don't get hunted. Okay. Mm-hmm. So we need good, clear distance vision to survive in this world. But now, because the world have become indoors, our jobs have become indoors. We're not farming outside. We're not hunting outside. We are having to focus up close about an arm's length all day long, sometimes 10 to 16 hours, which is not normal. So that strain on the eyes, that demand on the eyes is not healthy, and it causes it is correlated highly to myopia development. That's why people become more nearsightedness, or they can even become nearsighted when they had no previous history or family history before. So devices have a huge, huge impact, and they also keep us indoors. I believe that being outdoors and light exposure, natural light, sunlight exposure is so healthy for the eyes, and it facilitates normal growth of the eye the way it should be, because kids were supposed to be playing outdoors. Ask your parents. We were always outside. We used to get in trouble because we didn't come home in time for dinner. Now it's the opposite. We have to push our kids outside. The weather doesn't cooperate half of the time because we're living in the Northeast, and but there was very little myopia back in India. And now even in India, myopia levels are rising because people are indoors and they're with devices. So devices play a huge role.
And ideally, when we are using screens, how much rest would be ideal?
Yeah, so I like to tell my patients to follow the 20-20-20 rule. So every 20 minutes, look 20 feet away for 20 seconds. Make sure that the eye has a need to look at something far away. So you can look outside the window if it's daytime and focus on something outside for 20 seconds. Breathe, change your posture. A lot of the times when we are on devices, we're hunched in, we're close to our device, and we're stressed out and strained. So it's important for us to open up our physiology, open up our chest, breathe, drink water, stand up, and walk around for half a minute. It really helps. So that's the 20-20-20 rule. And then just I tell people there are a lot of things that people do on their small phones that they can do on a bigger screen. So a TV screen that's far away is better than a desktop. A desktop is better than a laptop. A laptop is better than an iPad. An iPad is better than a phone. So a lot of the kids today watch Netflix on their phones and in bed. The posture is bad, poor in bed. They're really close to their phones, and their eyes get worse. So, I say, let's do a trade off. Let's watch whatever you're watching on TV, I'm sorry, on your phone, and screen mirror it to whatever your big TV or screen. So it's much better that way. It's I mean, healthy habits, vision hygiene is very important for normal development of the eye.
And what other daily habits would be helpful to incorporate into our daily lives, including diet, lifestyle wise, that can really help protect or even improve eye health?
Yeah. So first of all, limiting your device use as much as you can and I say that with with guarded precaution, but because I know a lot of the kids, including yourself, don't have the ability to do that because you guys have a lot of work to do, and everything is on Chromebooks or a laptop. So it's very, very hard to cut down screen use. Other ways is increase your sleep time, which is also very hard for you guys to do. So increasing the amount of getting 8 to 9 hours of sleep is very important for the brain to develop and de-stress. Shed that stress during the day that you've accumulated. So sleep gets rid of, and sleep is like sort of your, I don't know, it's like your washing machine. It kind of like gets rid of all the gunk and the brain gunk. So and relieves you of the stress. But kids don't get enough sleep, or they don't prioritize sleep because they come home, they take a nap, they start work late, and they're up till 1 or 2 o'clock. So good sleep habits, good diet, just a balanced diet. It doesn't have to be too crazy, but don't be so picky on foods. Just try everything. Try all colors, fruits, vegetables, meat, eggs, protein. You need everything for a growing body because, believe it or not, we're highly strained with our eyes. So diet, lessening of the screen device use, sleep, and good healthy social interaction with your peers is very important. So, having young kids having play dates, your age, just hanging out and laughing, de-stressing is very important. Having a good community of friends that support you is very important. And obviously a good home environment is important. A good, balanced, a peaceful home environment is important. So all of it.
And with that, we've concluded talking about our adolescent health and eye care. And now we'll be moving on to our next section, which consists of some common myths. Number 1, my parents wear glasses, so I will probably have to as well.
I would say probably true. It just play a big role. I don't know if that's a myth, but it doesn't have to be true. But I would be vigilant in that child. Both the parents are wearing glasses. I would be vigilant to make sure I catch it early on if that's developing in a child. But yeah, it's highly correlated.
Interesting. Next, pink eye is contagious.
Also not a myth. Certain kinds of pink eyes, viral conjunctivitis, can be very contagious. Yes. Yeah. Not all pink eyes are contagious. Yeah. So bacterial pink eye doesn't have to be contagious. Pink eye is just a general name of an eye getting red, and it can get red if you have shingles in the eye. That's not contagious. it can get red because you've had a cold and that bug got into your eye, and it's really highly viral, and it can be contagious. Or it could be just you got dirt in the eye, or you wore a contact lens, overwore the contact lens for more than you needed to, and now you have a bacterial conjunctivitis, and that's not contagious. So different pink eyes present differently, and some are contagious, some are not.
Number 3, reading in dim light is harmless since my night vision is good.
That is false. Reading in dim light is not healthy, and because it introduces high amount of strain. The eye is working to see clearly. The contrast on whatever you're reading, if it's a paperback book or textbook you're writing in, it reduces the black on white contrast, and that introduces strain and stress on the eyes. So if you do that enough, it's probably not a good thing, and it's not harmless. It will harm you.
Number 4, eye exercises can cure nearsightedness.
That is a myth. If that existed, we would have learned it in the biggest institution of optometry in New York City that I was trained at. There are eye exercises called vision therapy that we can do to ameliorate or to help myopia progression in addition to other myopia treatments. However, that's not the mainstay of myopia control. So we can, and vision therapy or eye exercises are very useful in treating conditions like amblyopia that we talked about before, or eye teaming if the eye teaming is not perfect, or the child has difficulty with reading comprehension. Their eye teaming is not perfect. They can't read as fast as normal. They can't comprehend. So vision therapy is very valuable in those cases, but not in myopia control.
And lastly, staring at screens for too long can eventually cause blindness.
No, not eventually. No, it doesn't cause blindness. It will maybe cause a refractive error like myopia, maybe. So not everybody, you can't have a blanket statement that if you do this, everybody will get this. No human being, no disease, no issue works like that, right? Your likelihood of doing that activity raises your likelihood of having certain eye diseases if you're primed with genetics, right? So it all depends on a lot of other factors. But yes, generally it's not really a good idea to stare at screens. Having said that, we all do that all day long. I've worked all day on a screen, and I'm doing a podcast with you at 8 p.m. today. So there you have it. But my eyes are good, and so are yours.
And with that, we've concluded our myth section, and we'll be talking about our final discussion questions. What was one of your most challenging patient encounters or cases that you had to deal with?
One comes to mind. Oh my gosh, there's a lot. I have this amazing patient. We will call him Mr. G, and he has very tough dry eye to manage. So he can't function at his job because of his dryness. We've tried a lot of different treatments. We've finally come to a treatment that is working for him and to manage it, to lessen the severity. But that has been probably one of my most challenging cases because he is the nicest guy. He does everything for everybody, and he just can't see because of the dryness and how much severe effect he has on the cornea because of the dryness. So that's one. And Number two comes to mind, a young kid that came to me. He had he had high myopia with astigmatism, and usually doctors wouldn't take that case because of a high astigmatism factor. But besides having myopia, he also had walking issues. He was very introverted, and he had a lot of social acclimating to social settings where he didn't have friends and friends would bully him. He was a little overweight at that time. He had hip issues. He couldn't walk. So I decided to take that case as a challenge, and it worked out beautifully where I was able to get him from 2400 to 2030 functional vision without any glasses or contact lenses. We did ortho K on him, the nighttime lenses on him, very specialized, very custom lenses. And he's been doing it for probably the last 7 years. He's very happy. He went from being an introvert to an extrovert. Went on to college. He's graduating this May from college. He got bilateral hip surgery, so he improved his gait. Walking is normal. He shed a lot of weight. He has a lot of friends, and he's going to be. He just got hired for an amazing job, and he still comes to me after, I don't know, 8-9 years, and he thanks me for being a small part of changing his overall, life, the quality of life. So that was very challenging, but I'm really, really proud of him and myself for trying to do something that I didn't think I could do, and for the parents to believe in me and their dedication. I remember in the beginning he couldn't get his ortho K lens in during the weekend, and I went to his house to go find the lens because they couldn't find the lens. We found the lens. We actually put the lens in his eye. I went twice, in fact, to make sure that he was able to get his lens at night. And that was my early days of ortho. I would have done anything to make sure that the kid was good. And when I got the call, I went to his house to make a call at his house to fix the situation. So that was, yeah, those two cases come to mind.
They were very heartwarming stories. And do you feel that, cases like these really push you and motivate you while you're at, your workplace?
Yes, that's what keeps me going. It's not easy to run a practice, a business, to hire employees, to manage employees. They say business would be a lot easier if it weren't for customers and employees. I have both, thankfully. And business comes with its problems, but I have matured in managing my business, and those cases and those stories, and especially, and there's so many more, Eshika, there's so many more, but I won't go into all of them, that remind me why I do what I do. And I know that for a fact that every healthcare provider, it becomes monotonous. And for your listeners that want to go into healthcare, you better love what you do, because it is a labor of love. No matter how much money you get or not get, you do this because you love humanity, you love people, you love your craft, you love your skill. And when you get these people with cases that are success, you hang on to those memories when the going gets tough. And it is definitely a source of inspiration and pulls you forward.
It's really inspiring. And while we're talking about sort of the evolution of, digital devices and many new things that are appearing in healthcare, what do you believe has changed most from when you first started working in this field to now?
What has changed? I think the technology of how we capture information, how we interpret the information. I have so many instruments in my office that makes it easier for me to interpret or capture the data. And then I have softwares in my office that help me interpret the data meaningfully, so I can make clinical decisions much easier. So technology is the biggest thing. And and I don't know if you were going to ask me this, but what I expect to happen is to AI to really help me in the future. AI is amazing. I don't think AI is going to replace doctors, no matter what Elon Musk says. I am a fan of Elon, but I do not agree that AI would, or robots would, replace doctors. The more AI we have, the more efficient we become, but the people, the diaspora, the customers, the patients need that much more human touch. So now I go on, let's say I go on social media, and my feed, I don't know if it's AI or not. And if I think it's AI, I get kind of annoyed with that AI feed because I don't want to see a video that's AI. You want to, as a human, you want to connect with humans. So as much AI is coming the forefront, and it's going to change the world, I think in many, many ways, it really is going to change the world. It becomes human interaction, human touch, figuratively, becomes so much more important. So that's going to change the world, but we have to be ready for it. Your generation has to be ready for it.
Yeah.
And embrace it with respect, love, and you have to innovate constantly as yourself, as your human being. You don't even have to go to college now. You have a lot of that information, a lot of the medical books on AI can teach you better than any professor can, but you still need a degree from an accredited college, a university, a medical school, so you will go, but learning will become a lot easier for you. I'm sure you're already using ChatGPT or Grok or whatever to learn, to use models to understand the eye, to understand the body, to understand the human being's psychology, whatever it is. AI is a better psychologist than most psychologists out there are, but you need human interaction. You still need a human to talk to. Still need a human doctor. You still need humanity.
I agree. And while we're sort of talking about how AI is revolutionizing healthcare, what is your take on Google doctors or like even AI doctors?
Yeah, I think they will be very good as to facilitate. There's data out there that Google AI doctors can diagnose a disease 92% time, 92% versus correctly 92% versus a human doctor diagnosing it correctly about 70%. So there's a 20% difference in accuracy for AI. So AI, Google Doc or AI agent for any healthcare field is going to be very important in facilitating correct diagnosis. But again, I go back to the fact that good doctors, you make a good doctor not only because you can diagnose correctly, but because you have that human touch, because you have the power to inspire your patients, you have that humanity, you have the gratitude, you're in touch with God in a different way than AI would be.
Mm-hmm. And with that, our podcast session has come to a conclusion. I would like to thank you once again for your time, input, and overall contributions. I found this episode incredibly interesting, and I would assume our viewers agree. And for our viewers, we do have a special slogan from Dr. Miglani.
Nourish your habits to flourish your lifestyle.
Thank you.
Thank you so much. It was a real pleasure to be on your podcast. I wish you the best. And it was a great fun to do this.
Thank you.
Thank you.